First of all, you guys already know about me, so I will skip this introduction. Currently, I'm a physiotherapist and also a clinical exercise specialist because I'm graduate from the University of Science Malaysia with Master of Clinical Exercise Science, also Bachelor of Physiotherapy. So I'm also an educator and also doing a practical and treating the musculoskeletal problems and also cancer consultations. So, okay, let's go to the overviews of the cancer first. So let me do some introductions and what is cancer all about. Also, roughly, we are going to the characteristic and benign and the malignance of the neoplasms and what is the difference. As we physiotherapy, we no need to know about a lot of the we can say pathophysiology or histopathology about how's the feature of the cancer, but it's nice to know and we know how to explain to our clients or the patients. So roughly I will go through it. So what is benign tumors and the malignant tumors. So what is a benign tumor is that from the benign tumor, what we can differentiate is that the cells of the benign tumors are all same and same size and well organized, and they are not grow in a very fast speed, but just grow very slowly and grow localized. It means that the cells only grow at the same place only. But the malignant tumor, you can see from the microscope, is very the shape is not beautiful. I can say it's not beautiful. They have the under microscope. You can see the big and dark nucleus is symbolized, and we can represent that is abnormal cell, and they are irregular shape with each other and not the same size, and organized is not organic matter. They just organize in the way they want, and they are growing very fast. And can they spread to other places? Sometimes they will go to the surrounding tissue, some will go to the other organs. And when they growing to be very aggressive, so they will grow their own capillary. We always say that there is a capillarization. We also say we call it an angiogenesis. They even grow into the lymphatic system and blood vessel to take their own nutrients. And some cells, they are not getting enough nutrients. They're going to die. We say necrosis and form the ulceration. But the benign tumor, we cannot see any ulceration, and the skin is very intact and beautiful outside. We can't see the lesions. We can say lesion or ulcerations outside the tumors and the surrounding of the skin. So this is the difference between the benign and not benign tumor. And what is the comparison that I explained just now is that the benign tumor, they grow very slow. Malignant tumor grow very fast, and the benign tumor then grow very nice organized shapes, and the non-benign tumor they grow invasive, infiltrating surrounding tissue, and sometimes they grow into the surrounding organs and invade into the other systems such as the lymphatic system and vessel. So this is the naming. So you can see always say that when the patient comes to you, they have the cancer, they're always the tumors name always ending with OMA. OMA means the tumor, but the malignant tumor, we always can see some common words that is sarcoma or carcinoma, or some special words that blood cancer we can see is a leukemia or lymphoma, also OMA, but the more special one is leukemia, no OMA, but it's common. We know that it's a blood cancer. So we can see that the name common one is like that. So we can differentiate the name of tumor. Okay, what are the risk factors of the cancer? So today's topic, we are going to talk about a lot of cancer. So we need to know about the risk factor, what reason and what factors that can trigger the cancer growing. Okay, the first one is the aging. Okay, aging, as age increases, go to the geriatric populations. A lot we can hear that a lot of the people were having cancer in the older age. And why there's less percentage and less chance and less younger people have the cancer is because younger people, we have the strong, we say is the genome maintenance. Genome maintenance is that is our checking point in our body, where our body can check the mutate cell. When the cell is differentiate and growing in our body, a lot of the mutation will take place actually in the young age also. But when our young age, our genome maintenance is proper function, they're going to check and filter out all the mutate cell. So they will all filter out very quickly to find out where is the mutate, and they will make the cell become die, we say necrosis. But when the old age, the genome maintenance is going to decline. So the older age people will tend to have the cancer because it's very difficult for them to find out the cancer cell, the mutated cell. So and another one is smoking or alcohol consumption, where you can find that if your young people smoke a lot or do drinks a lot of the alcohol, they can also cause the having the lung tend to have the high intensity to have the lung cancer or liver cancer, because all this we say is something like a carcinogen will cause the cell to mutate very fast. And another one is occupational cancer. We say when people exposed to the occupational hazards such as the asbestos, it can triggers the GI or lung cancer. Or hereditary. Hereditary is a family history. Okay, so family history is we can say can count into the risk factor, considered as the risk factor, but study shows that hereditary only consider and contribute 10% of the three cancer happening. So hereditary is just one of the reason, but only contribute 10%. Okay, so either you have the family history of cancer or childhood cancer. Okay, another one is obesity or someone who has chronic metabolic disease like diabetes, and including the unhealthy lifestyle, physical inactivity, we can trigger the breast, colon, kidney, or pancreatic cancer or other cancer also. So why? And because they are another mechanism is that when you are physical inactivity, means that you are not moving a lot and you are eat a lot of the unhealthy food, we can see that mostly unhealthy food will cause a fat deposit on the abdomen, means your tummy is getting bigger. It can cause a macrophage infiltration of the visceral fat. Fat accumulate a lot in the tummy, so causing the big tummy. Actually, a lot of the fat deposit can trigger the chronic systemic inflammation. Mean when the fat is deposited a lot in your body, it causes a lot of the cytokines and interleukins or all that form released from your body immune system. It can cause a lot of the insulin resistance, means your insulin is not functioning properly. You can cause the diabetes, arteriosclerosis, increase the risk of the cardiovascular disease, neurodegeneration. Tumor is growing because systemic inflammation. Later, I will explain more about this. And then had a high chance to get the breast cancer, colon cancer, and other cancers too. So, okay, another one, we will need to know the clinical presentation when patient comes to you. Some cancer patients will have the unexplained weight loss, mean involuntary weight loss. They don't know why. When they eat a lot, their weight also and continue to drop, and no reason. It drop in no reason. And fatigue, the fatigue does not reduce and does not persist. The fatigue is always persist in the years or in few weeks. On the fatigue does not release after you having plenty of the rest. So this is one of the clinical presentation of if you're having cancer or fever, night sweating, change in bowel habits, bone pain. The pain is intolerable. It's not same with the aching pain, not same with the muscle pain, or nose bleeding, bloody stool, or coughing with the blood, and so on. And then grading of the tumor, we can need to know that grading, what is the grading of the tumor is that grading of the tumor is like what you need used to estimate and identify the aggressiveness, how active the tumor is this. So it's not same with the staging of the tumor. This is only the tumor, how the aggressiveness of the tumor, how activeness of the tumor is growing in the localized. So it will be classified also into grade 2, 1, 2, 3, and 4. So staging, what are the staging? Staging, how they going to see when the patient have, for example, breast cancer. So breast cancer stage 2, stage 1, how going to doctor going to find out how is the stage 2? And example, when you have something like symptom, for example, the breast cancer, you have something hard lumps on the breast. So you go to, of course, you will go to clinical examinations, go to see the doctor. So doctor might do some tests for you, surgery or the lab test or tissue biopsy. So use a fine needle to pull up some tissue, go and do some tests, find out what cell are there. But if the cell is the positive for the malignancy, doctor will going to suggest you to go for another surgery to remove all the structure, or the partial structure will need to be removed, or surrounding structure, and go for another one is a radiographic assessment, either CT scan or SPECT scan, to find out where the cancer cell has spreading, where the cell has spread to, either organ or surrounding tissues, soft tissue, or to the bone. So only doctors will design what is the treatment they are going to use. So a lot of the treatment they are going to use, how maybe the surgeries, hormone therapy. Hormone therapy is mostly used to the who are on breast cancer, uterus cancer, or the colon cancer. Immunotherapy, something that the drugs insert drains into your body so that they will boost your immune system to fight the cancer cell. Or bone marrow transplant, normally for the leukemia or lymphoma. Or radiotherapy is for the radiation to hit and kill the cancer cell. Targeted therapy is the new technology or the new drugs that are used to, instead of the chemotherapy, you need to circulate the whole body. Target therapy is the drugs, either you go into the IV, drain into the through the IV, so that they will target on the cancer cell only. So, okay, now we are going to the main topic. We are going to say cancer-related fatigue. So, what are the physiotherapy management we can do for the cancer patients, or what are the exercise therapy can use for the cancer patient? So here I'm just sharing about what is the general cancer and general physiotherapy treatments that we can do for the. I will go to roughly and give some brief idea on how to manage the cancer patient. So if you go into the deep, like breast cancer or certain cancer like lung cancer, we are going to the deep, that might take a lot of time. So today I will give you the brief idea, a lot of the idea, then you will know that how we can tackle the cancer patient. So before that, we're going into the side effect. We know that a lot of the side effect we need to know, and a lot of the side effect that facing by the cancer patient during the cancer treatment, especially we can say particularly specifically is the chemotherapy. Chemotherapy do a lot of the side effect, a lot of the patient, and all these side effect is not all the patient will have. Some of the patient will have some of the patient common side effect will, a lot of the common one will be a fatigue, and some a common one will vomit, diarrhea, hair loss. But hair loss, we physio can't do a lot for them. We just need to advise them or educate them to be hygiene. And kidney problems, and especially we need to target on the fatigue, weight loss, especially weight change or weight increase, or muscle pain, reduced range of motion, and so on. So the other one, either infections, fertilized problem, anemia, we need to take extra precaution. Later I will explain how to take extra precaution. So, okay, what are the fatigue? The fatigue that experienced by the cancer patient is not the same with normal individual. I can say the fatigue during the cancer treatments, during having the cancer before the treatments, during the treatments, and after the treatment, the fatigue cannot relieve by rest, and even it can persist after years or months after the treatment. So this is normal, and the fatigue is not the same with the normal individual. Why it should be like that? Okay, we need to know about the cancer-related fatigue and cancer cachexia, which is a type of the energy wasting syndrome. Just imagine, a lot of the people, we might hear that one of the clinical presentation of the cancer is weight loss, right? Okay, weight loss, why? Why the cancer patient will have will lose their weight? Because when the tumor is growing in your body, the tumor need to be survived by glucose and amino acid. So why and where they find the glucose and amino acid is they will break down your skeletal muscle. So when a tumor is growing inside your body, they will start break down your glucose and amino acid to get their nutrients so that they can grow even bigger and bigger. When they grow even bigger, when your body structure is going to break down by the certain, we say outsider, we say another outsider outside from our body, our immune system will fight back. So now inflammation is triggered out. When the inflammation is triggered out, the tumor, because the tumor, like I say, like it's a malignant and it's very aggressive, it start to mutate like the COVID virus now. It start to mutate, and further it mutate, even become stronger, and it eat more, become bigger, and eventually, finally, our immune system will fail because our immune system will really become weak. It will invade and take over our body, so it will cause metabolic imbalance and become normal. They take over our body. So when our immune system is already loose, the cytokines are interleukin or in the inflammation again and continue to trigger by because of the breakdown of the skeletal muscle, fat loss. Of course, fat will loss continue, you become thinner and thinner, and we can say it is an involuntary weight loss. And systemic inflammation, when your muscle is already break down, you really become thin, the tumor will start to grow to other organ, will trigger the systemic inflammation. And when they take over the other organ, they'll make you lose your appetite, anorexia, anemia, and malabsorption. That's why the cancer-related fatigue, you can define as a persistent, subjective sense of tiredness related to the cancer and cancer treatment that interfere with usual functioning. And they are different from the typical tiredness and most people experience as the normal daily life. And it's not relieved by rest or sleep, or they will continue until your body become very weak. That's why we call cancer cachexia. Another one we need to take note is the cancer patient, they do have cancer sarcopenia. What is sarcopenia? As we know that sarcopenia means that loss of the muscle. It's not a systemic condition. Like just now, cachexia means your body already lose and lost a lot of the nutrients, means that your body becomes cachexia. And sarcopenia means that you lose a lot of the muscle. You lose a lot of the muscle, it's not a systemic condition. And when the patient, you just imagine that if the patient will say there's advanced stage 3, 4, and terminal stage of the cancer, they mostly will very, very thin. And cachexia means they're not enough nutrient, malabsorption. We can see their face very pale and anemia, not enough blood. So when this kind of patient, not enough nutrients, malabsorption, they go to the chemotherapy, surely they will become very, very weak and poor survival rate. Because why? Because the higher the level of the cachexia, The poor the tolerance of the chemotherapy, they will show more the higher the toxicity of the chemotherapy and more the muscle to be lost. That's why we can say that lower survival rate and poor tolerance to the chemotherapy during advanced stage of the cancer. And however, some of the chemotherapy-related toxicity influence the body composition. Whether the chemotherapy can cause the muscle to be continued to lose is still unknown. The mechanism is still unknown, but study really shows that they can make the muscle even lost more muscle, but the mechanism is still unknown. Okay, some of the patient, cancer patient, they even become their weight even become increased. Some of the we can see some of the patient, you will see that after they go to the chemo, they even thinner. But some of the patient will become increased in weight. Whether this scenario, the condition, this scenario, whether good or not, the answer is not good. Why? Because when you gain fat, actually gain weight, actually it's weight gain. It's not it get weight. The muscle is not increased. When you're losing in the lean muscle mass, protein metabolism observed, but increase in the body fat and water. Because one of the reasons is the chemotherapy can cause water, fat, and muscle imbalance. And some of the reasons cause the weight gain during chemotherapy is that they reduce the energy expenditure. A lot of the cancer patient, during the treatment, they doesn't move a lot. They reduce their physical activity. They increase their diet intake, eats a lot. They do a lot of the hormonal change. They got a lot of hormonal changes because of the chemotherapy or the multiple agent chemotherapy regimen. And this is not good because most of the chemotherapy agents are lipid soluble. That's why if you have a lot of fat, you will facing and encounter, you will feel a lot of the side effect of the chemotherapy. So increase the toxicity of the chemotherapy, you feel more side effect. You will increase the hypertension risk and heart disease. You increase the diabetes risk, stimulate the tumor growing, because one of the reasons for cancer is body fat increase and obesity. Because obesity and fat percentage increase can trigger also systemic inflammation, and you are increasing the tumor to be growing, and decrease the efficiency of the chemotherapy, increase the musculoskeletal distress. When your body become big, become increased, weight become increased, you are given a lot of stress to your knee. So will trigger and cause a lot of knee pain and pressing a knee and speed up the forming of the OA. So reduce of the quality of life and poor prognosis. So when the physiotherapy or rehab should be included and start for a cancer patient, actually during the treatment or after the treatment, exercise and physiotherapy can be started gently, so we can improve their quality of life. Okay, what are the concerns we need to take from us to the cancer patient? So first one, we know that they got cachexia, they got the sarcopenia, so their muscle mass is lost. So when the muscle mass is lost, automatically pain and weakness they will encounter. They will reduce the muscle strength, power, and even balance. Their body BMI changing, their fat percentage increase, decrease of the limb body mass, and increase of the water too. For even more severe case, they even impair physical independence and go into the wheelchair bound. So fatigue, of course, is very common and reduce the range of motion and lymphedema or neuropathy. Okay, goal. What are the goals we're going to put on the cancer patient is that we're going to improve the range of motion. Later, I will explain more. We need to do the pain management. We need to improve their muscle strength, increase their physical activity, functions, and improve their immune function. Because when you improve their physical activity and make them become active, you automatically can boost the immune function. To reduce the fatigue, improve the balance, and reduce the treatment-related side effect. So, when we going to manage the cancer-related fatigue, as we know that cancer-related fatigue is persistent and is not relieved by the resting, so we need to very careful, handle it very careful. So firstly, we need to assess the level of fatigue, not just use the pain VAS scale, visual analog scale. We can assess 0 to 1 or 1 to 10. So 1 is the very minimum fatigue. 10 is a very, very fatigue that they not even, not even open their eye or even not enough energy. So if the fatigue is more than 4, means the moderate. So we need to find out the reason. We need to find out reason whether we assess the contributing factor of the fatigue. Either I use a physical fatigue or mental fatigue, or either chemotherapy that make you fatigue, or medications, or malnutrition because they not enough eat, or they eat the food is not that nutrients. So we also need to check with the patient, chatting with patient to check other mental health, because fatigue we can divide it into 2 types of fatigue: physical fatigue and mental fatigue. Physical fatigue is that when you have the muscle weakness, you can't do a lot of movement and your muscle will feel sore or pain. That is the physical fatigue. Mental fatigue is that your muscle can move and can do a lot of work, but your mind say you can't do. That one is the mental fatigue. So we can check with the patient to check whether their mental health is okay or not. If the mental health is not okay, they will really refer to the psychologist, psychiatrist, or yoga therapy. We can assess the muscle condition. Muscle condition, we use manual muscle testing, we check the posture, and we check the RM. If the visual analog scale is below 4/10, we need to educate the patient to continues to stay active. That means that the fatigue is not that high. But then if the patient is after the surgery, we need to do pain management, range of motion, and education for them. How we going to assess the mental health of the patient? So we can use, since we are not a profession in the mental health, we can just use the checklist. This is one of the example. Of course, if you have another checklist, you can use also. This is just one of the example. Call it burn depression checklist. Just check it whether 0 is not at all and 4 is extreme. Ask all the questions and record it. After few session or next session, just record another one new, do another new record, so we can check back whether their mental health is increased or decreased. Okay, another one we can manage for the cancer-related fatigue is that we need to ask for the exercise history. So when you fatigue, what exercise you do to release your fatigue? When is the onset of the fatigue? Patterns, duration, how long is your fatigue? And does your fatigue change over the time or associate with other factor? Just ask the patient and record. So we have the idea that is this patient is active before the cancer and during the cancer. So if the patient say that, because before the cancer, I got do a lot of the jogging or a lot of the exercise, outdoor exercise. So we need to suggest them and educate them on continue to do exercise, but we slowly and do the progression method. So what are the exercise and suggestions we can do for the patient? Actually, during the cancer treatment, we need to suggest them to physical active also, but some precaution we need to do. We'll encourage them for home-based walking, just walking, and the intensity, we need to take note, the intensity of the exercise is very, very low. Aerobic exercise should be done because as we know that aerobic exercise is for the lungs and heart function. So we need to do the aerobic exercise, but we cannot very specific for in modify the intensity. Just ask them to do some gentle dance and do some music with some music so that they can enjoy and adherence and adapt and stick to the exercise. So perform then to from 10 minutes to 45 minutes per day. So if they can't do, just leave it for interval. That means that we do it for 5 minutes and go to some rest, few minute rest, 2 to 3 minutes rest. Then after the continued 5 and stop. So we use it progressively. After the next session, we check again and slowly we increase some time until they can do for 45 minutes, but not force them. Okay, so our aerobic exercise is the preferable to do 4 to 6 days per week. But if they can't do, we just do it alternately. Just 2 or 3 days per week is more than enough for them. And the exercise treatment, we suggest and encourage to continue for 1 to 6 months so that we can see the effect. If they only do 6 months only, we can't see the effects very well. Okay, so if they want to do yoga, it's also okay. If they have a lot of the mental stress, so we need to prescribe a more relaxing exercise, can go to yin yoga or either yang yoga. Or breathing exercise can be help them to release their stress and reduce the tiredness. Or someone who know Pilates can help them to do Pilates, Tai Chi with a very low intensity. So it is suggested to do 2 times per week or 60 minutes per session. Resistance exercise is very important for them. Although you are doing for increase your heart and lung capacity, but resistance exercise is very important to you to improve the muscle power and increase the muscle mass. So we can start from body weight first. Just do it for a few times. So for example, like SLR, straight leg rise for 10 times. Just use their weight, the weight of their leg, lower limb. Then after that, we can progress to TheraBand and progress to dumbbell or sandbag. The protocol is 2 sets, 8 to 12 repetition and 3 times per week. And we also need to take note, not force them. If they tired, just do interval, stop at the middle and do it another time. Okay, hydrotherapy can be done, but just after the cancer treatment because we don't want to trigger any infection. Okay, this is the fatigue symptom involuntary. If you don't know how to assess the level of the fatigueness of the cancer patient, you can just use this checklist, this questionnaire, just mark there and repeat another time so that we can keep a record and know how is the level of their fatigueness. This is another one called the questionnaire on the distress of the cancer patient. Okay, another sample you also use for quality of life. We can also check on their quality of life so that we can know about their mental health, we can know about how they are thinking. So this is one of the example. If you don't know how to assess, so we just do the questionnaire, it even make us more easier. Okay, so in order to make the cancer patient very enjoy and stick to the physical activity, we can just prescribe I will make you I make here a sample so that we can just like make them and we can teach them how to be a structural exercise they can do. So to make it more enjoyable in the exercise, we can ask them to do warm up first so that we can reduce the injury during the exercise program. So warm up should be 10 5 to 10 minutes, just a simple range of motion exercise for all over the joint, the body. Then after that, we say frequency, we can do it for 3 to 5 times per week. Either we want to use do the exercise, we will need to separate into you can combine. Either is one session you can combine aerobic and resistance exercise, or one day you want to do aerobic exercise, another day you can do the resistance exercise. So I will suggest and I will say that resistance exercise and aerobic exercise are very equally important, because resistance exercise is going to build their muscles since they already sarcopenia. Another one, aerobic exercise, will going to improve their heart and lung function, aerobic capacity, immune function, and also improve the quality of life. So if you want to do resistance exercise, we just assess and target for the group big muscle. Do it 16 to 25 repetition. This is for the advanced. But if for beginner, we just start from 8 to 12 or 10 to 15. Lower intensity, either body weight, TheraBand, or sandbag or dumbbell, and repeat it for 3 sets. And between the set, we need to get the patient for some rest, 2 to 3 minute rest. Okay, aerobic exercise. Aerobic exercise, we need to see the condition. Aerobic exercise, as we know, that cycling, walking, dancing, or dancing or so on. But if the patient, let's say, their lower limb is very weak, they very don't have good balancing, we just get them to the cycling. But if they can walk very well, their lower limb muscle is good, so we can take them to some walking around the natural environments, or outside, or either indoor. And the times we don't need to push the patient so much, because they already so weak. So we just encourage 10 to 20 minutes first. Then after that, we push them to 30 minutes. And cool down, we need to include a cool down exercise, slow walking, and together with stretching. One muscle group we can hold for 10 seconds. If the muscle is very tight, but the muscle is not so tight, we go to 30 minutes. And precaution we need to do is we need to continue to check their heart rate and also blood pressure. VO2, you can calculate the VO2 if you want, but you can neglect it if it is okay. The breathing rate, blood profile. Okay, before exercise, the patient comes to you. Before the patient comes to you, start the exercise, we need to check the blood profile. If the blood profile, let's say the white blood cells very low, or they have anemia, we can't continue the exercise. Later, I will explain this during end of this webinar. I'll continue to check their facial expression. Facial expression, we can know that how the level of exertion. Okay, energy conservative method for fatigue. Okay, energy conservative. If they really fatigue and cannot do anything, we can suggest them to encourage to stay active, but we can, for example, 1, sit on the chair while doing the upper limb exercise or chair aerobic exercise. We can advise them to take plenty of rest in between the physical activities, try the easy and shorter version of exercise, and do only necessary activity in the house, and do all the daily activity with slow movement, for example, bed mobility and walking, to reduce and preserve your energy. Okay, before exercise or after exercise, before surgery and after surgery, some of the cancer patients might go to the second even a lot of the surgery to remove the tumor. So before the surgery, we should educate. What we can, as a physiotherapist, can do is educate the patients about the possibility that would happen after the surgery. We'll tell the patient, for example, if the patient will have breast cancer, the possibility for them to to happen after the surgery is reduced range of motion of shoulders or muscle tightness. Okay, just imagine for the breast cancer. Breast cancer for imaging, she will going to remove the whole breast for right side. So just imagine if you going to remove it, so your pectoralis major muscle will go in tight because they're going to suture and pull and close the wound. So your posture will totally run off. What will happen is your pec major muscle will become tight. When the pec major muscle become tight, you pull your internal rotation of your hand. So your external rotation of your shoulder will become, and range of motion or external rotation will reduce. So they will possible to reduce range of motion, shoulder, muscle tight of the pec major, reduce exercise tolerance, of course, because once the anesthesia come in, it will paralyze your diaphragm and your lung function and heart function will decline. And reduce the lung capacity, muscle weak, your back muscle will become weak, pain of the wound, tend to have infection. If they are going to remove the lymph node, they will tend and high percentage to have lymphoedema. Okay, so we need to assess the bilateral extremity function, both hand, both shoulder. We need to assess so that we have the baseline, we have the record, so that we can know that the range of motion before the surgery, how much. Gentle range of motion should be start after straight the pain subside. Generally 1 to 2 days after surgery, range of motion should be done. And active stretching exercise should be start 1 week after the surgery. So first, range of motion. Second, active stretching, or start after the drain is removed and or during the 6 to 8 weeks after the drain is removed. Then after that, we can do some soft tissue massage if the wound is already okay and dry, and continue suture up. And at least 2 weeks after the surgery to increase the range of motion. Okay, post-operative assessment should be done up to 1 year. Even after the surgery already, keep follow up with the patient for 1 year. If they come to see you, just keep following up to 1 year. And resistance exercise should be done with lightweight, 0.5 to 1 kilo within 4 to 6 weeks, and heavy weight more than 1 kilo after 6 weeks only. Okay, what is lymphoedema? Lymphoedema it will happen when the patient remove the lymph node or do radiotherapy on the lymph node. So lymphoedema also refer to accumulation of the protein fluid in the interstitial space and compromise with lymphatic system. So either remove a lymph nodes, chemotherapy or radiotherapy on the lymph nodes, scar tissue and fibrosis, impair the proliferation of the lymphatic endothelial cell and compromise the lymphatic regeneration, or obesity more than 30 BMI will have the high risk to have the lymphoedema because inflammation, fibrosis, lipid metabolism cause adipose and fibrotic tissue increase the risk of edema. So symptoms of edema in that the patient will complain joint pain, limb heaviness, very tightness, or decreased range of motion. Okay, role of physiotherapy. What are the roles? We need to manage the lymphoedema. Lymphoedema, we need to educate them. Post-operative, straight after the surgery, we need to emphasize the exercise and educate. Modify the activity. Ask the patient not to lift the heavy object. Massage the scar tissue. Maintain ideal body weight. Avoid trauma to the wound or to the lymphoedema site so that we won't trigger the infection and sepsis. Encourage a long-term and consistent use of compression garment, and patients should be to be educated, lymphedema is a lifelong condition. Physiotherapy that we can use doing is we start to do the breathing exercise. When we do the breathing exercise, we can increase the blood circulation and trigger the fluid drainage to the lymphatic system. Post-surgery position up to heart level, above the heart level, so that the fluid can drainage to the upper body. Massage the scar tissue and stretching, mobilization exercise, manual lymph drainage, and massage therapy such as effleurage. But current evidence don't support that any medication, diuretic, diazepams, or any medication can treat the edema. Okay, another one, this is new technique. Some study already proved that it can reduce the lymphedema. It's kind of machine that can you put on the upper limb and lower limb to decrease the lymph volume or weight, reduce of the edema, increase the drainage of the water to come back out of the lymphatic system, prevent the secondary tissue change develop at the advanced stage of the lymph edema. This is the new technique, and it's kind of a machine that give some pressure to your limb so that you can pump the fluid in, not only the superficial fluid but also the deep fluid back to your body and increase the elasticity of the joint. Okay, this is just a new technique we can do, but what is the compared with the compression garment, what is the difference is that compression garment is just going to prevent the accumulation, the excess accumulation of the fluid, but this pneumatic compression is going to help you to drain the deep fluid back to the normal circulation. Okay, how we're going to assess lymphedema is that we're going to use measuring tape. The most basic one, we just use a measuring tape. If the swelling is more than 2 cm, it's considered as lymphedema. So upper extremity, we just metaphalangeal joint, the wrist, the 10 cm distal to the lateral epicondyle, 12 cm proximal to the lateral epicondyle. For hand, you just do the figure of 8, head and neck edema at the measurement at the single point of the upper neck. On lower extremity angle, figure 8, 10 cm up the lateral epicondyle, knee joint, and up the head of the tibia. Okay, pain management during the cancer treatment or after the cancer treatment. So cancer treatment, we can say that cancer, of course, they will cause the pain to the patient. Or during the chemotherapy can cause the muscle pain to the patient. A lot of the patient will complain of pain, and because of the muscle getting weakness, so the electrolyte imbalance in the body can also trigger the pain during the chemotherapy. So we assess the contributing factor first, whether it's the electrolyte imbalance in the body. We just see the blood test report, see any electrolyte imbalance. We assess the muscle condition, whether they are muscle weakness. So after surgery, we assess the wound, either the wound that caused them pain or muscle imbalance, say thigh and balance weakness the muscle. So we using VAS, visual analog scale, or numerating scale, or verbal scale also okay. So we assess the pain release, or side effect or adverse effect of the cancer, and prevent the recurrent pain. So what are the pain assessment? As I say, you can do another one, the simple description pain distress scale, or numerating or visual analog scale. So ask them, what is the intensity? How severe is the pain? How will you describe the pain so that we can know what is the muscle pain or because of the cancer pain? So where is the pain? Does the pain go anywhere else? When is the pain occur? What makes you pain better or worse? Or how is the pain affect your daily living? And does the pain means to you? So if we find out that it's a cancer pain, so cancer pain is normally we'll discuss with the doctor to see any medication will help, either morphine or what. So the medication part we just inform to the doctor. but ask just let the doctor to design what is the medication they're going to give. But what we can do as a physiotherapist, that the energy conserving and pacing activity. So bathing, walking, as I say, just in the slow speed, and walking around the bed, so we can increase the physical activity and reduce the anxiety and also relaxation among them. So if you're very painful, can be prescribed assisting device for them, just like the crutches for them to walk, or positioning instructor for someone who have the wound, or you can do it massage to patient. Okay, massage is okay, but do it very precaution is that we need to see the blood profile first. For example, the platelet. If the platelet is very low, don't do the massage for the patient because they have the high tendency for bleeding. Okay, heat therapy or cold therapy, they both is okay to use, but some of the evidence might say that the electrical modality or a lot of the modality you cannot use for the cancer patient. But for us, we can say that heat therapy is also like very less evident that prove that they either can trigger the cancer or not, or trigger the recurrent cancer. There's still controversy. So for heat therapy, we just do it not very heat, not very high temperature, just warm for them is okay. And ice therapy is okay for them if they have the wound and inflammation. Okay, transcontinental electrical nerve stimulation TENS also controversial. Since some book they already say that TENS is okay for the cancer patient, they won't trigger the recurrent cancer or stimulate the cancer growing. But the current, the RTC or cohort study is still not enough to support this evidence. So we as a physiotherapy, we just use it as precaution. Just like if the pain is really can't tolerable, or the palliative care, TENS can be acceptable. Gentle stretching or range of motion can be done. See if the pain is from the musculoskeletal side. Breathing exercise and yoga therapy for them to relax and reduce the pain. And music therapy, if the patient likes music before the diagnosis or always play music, just music therapy is good for them to relax, because since music therapy is their favorite. Okay, ultrasound therapy, shortwave diatomy, UV light or ultrasound therapy are definitely contraindicated for the cancer patient. Okay, stretching. Okay, this is an example of the breast cancer. We can stretch for the levator scapulae. Since the scar is on the chest, it's always related to the neck movement and shoulder movement. So what stretching we should do is stretch for levator scapulae, upper trapezius, pectoris major, medial lateral rotator of the shoulder, and progressive active or assisting shoulder exercise can be done, or PNS stretching and strengthening of the back. Okay, these are the summary that I already mentioned just now. Pain, visual analog scale. Fatigue, we also can use visual analog scale. Range of motion, we should do goniometer. Muscle strength, AMD or manual hand dynamometer. Sensory supervision, that one you can do for sensation also if the patient have neuropathy. Edema, measuring tape. Balance test be done if the patient have very poor balance, or you can see that you want to know more about their balance. Standing eye open, eye closed, sitting eye open and eye closed. And respiration, we need to measure whether they are SOB or not. Okay, what are the benefits of exercise for cancer patient? Why cancer patient need to be exercised? So we can see that increased range of motion, of course. We can improve their flexibility, reduce pain, and correct their posture. We can increase the muscle mass, resistant exercise particularly, increase their posture, reduce muscle imbalance, and improve balancing. And some more for aerobic exercise, we need to improve their heart function, particularly walking and cycling, increase blood volume and lower down the blood viscosity, increase the RBC production and mass so that reduce the risk of anemia, improve circulation, increase of the hemoglobin and mitochondrial oxygen transportation, and all these aerobic capacity increase can help to fight the cancer, reduce the side effect of the cancer treatments, reduce the systemic inflammation, boost the immune system, and inhibits the tumor growing. Okay, so when the patient already okay from the physiotherapy part, if the patient will go to the exercise training, such as go to the gym or personal trainer in the gym, is okay. That's one is considered as phase 2. Phase 1, we physiotherapy, we need to educate them for active, healthy lifestyle. We do some pain management, lymphedema management, improve range of motion, muscle training, balance, and ability for active daily living. They want done by phase 1. And phase 2, once the patient already completes the cancer treatment and they're already healthy enough, patient will want to go for exercise training. That one is phase 2 is okay. That one they can go for clinical exercise physiologist, or they will go to the certified and know more certified and know about the pathology of the cancer, who know about the personal trainer who knows about the cancer pathology. So exercise training, what we other can do is more aggressive one. So come to phase 2, intensity, we need to calculate the intensity. Either you're using heart rate reserve or heart rate max, or duration, we at least 30 minutes or moderate exercise, accumulate 150 minutes per week, either jogging, running, swimming, resistance, or combination of exercise. So before they go into exercise, they will ask you, hey, can I go to the exercise or not? We need to educate the patient also. The patient might require the reference letter from the doctor to the personal trainer or clinical exercise physiologist. Medical clearance need to be required, or pre-exercise testing is required also. Okay, so take notes. If a patient comes to the physiotherapy, we need to know that everything should be done is very gentle only. The intensity, we are not very specific on the intensity, but we always need to ask the patient to stay active. Always check with their blood test report, blood pressure, facial expression, and their treatment progress. Okay, platelet and RBC is very low. We need to discontinue the treatment. When the platelet level is very low, they tend to have bleeding tendency. When the RBC level is very low, they have the high risk of the infection. Okay, avoid trauma to the hand, arm, or foot, or any side of the body to avoid the infection and avoid any fall. Okay, keep the good hygiene. Always ask the patient to wear mask, or always ask the patient, and also ask the patient to wash their hands frequently. Ask them not to lifting heavy object. If they want to lift the heavy object more than 1 kilo, just after 6 weeks after the surgery. Assess their sleeping quality. Always ask the patient before start the treatment. Assess the quality of sleeping. Are you sleep good? Are you sleep well? How long you're sleeping? How frequent you sleep? Avoid put a lot of weight. Ask the patient and educate the patient not eat too much to increase their weight. Do not force them if they can't do the exercise. Be careful of their wound if they after the surgery. Make the environment always feel happy and relaxed, and talk nice to them. Advise the patient not to wear long sleeve or thick clothes during the exercise to avoid heat stress, and enough hydration, and a whole exercise or exercise at home should be supervised. Okay, thank you. That's all for my presentation.